Hello, welcome. Kristen Grace McGarry here. I go by Kristen Grace, and I am a holistic and integrative healthcare provider. I am a licensed acupuncturist. I'm certified in functional medicine, herbology, homeopathy, advanced cranial sacral therapy, and somato-emotional release. Lots of fun tools in my toolbox. I'm also an international speaker and author of 2 books, and I just completed my 3rd, and we're in the editing process. It's very exciting. And I'm committed to sharing this Facebook Live series with you. I've had a couple of technical issues, and so it seems like the Facebook Live isn't fully being live at the same time as I'm speaking. And so please, I'm hoping you're going back and listening and enjoying it. Please type in your questions and concerns and any other topics you'd like me to address. So today, I'm going to be talking about the importance of oral health, your mouth and your teeth, your gums, and your immune system, and your entire body. So many people don't connect their oral, gum, dental health with every part of their body. But there is a very, very cool dental chart that you can find online. If you look up dental chart and whole body, or dental chart, tooth chart, and every organ in the body, you will find a ton of pictures of these German and American and French, all these different perspectives of connection between every single tooth and each organ, system, vertebrae, gland, and meridian in your entire body. That's pretty cool. And so if you're having an issue with a particular tooth, you can look on that dental chart and find out what part of your body it's connected to. And as you discover what part of your body that tooth is connected to, you can then not only address the tooth, you can start to empower and support that organ, that gland, that meridian, that vertebrae, that part of your body. So these dental charts are really, really informative, and they show how intimately connected every single tooth is to every other part of your body, organ, gland, meridian, nervous system, and spine, etc. And so I wanted to share that information with you and emphasize the importance of dental health and your immune system, especially right now in this pandemic with COVID. People are struggling at home, and there's a really simple couple of things you can do for your body, for yourself, for your oral health to stay healthy and maybe even improve your health. So this isn't necessarily new, but I want to emphasize that flossing your teeth every single day is really important. Getting in between each tooth really well is super important. Brushing your teeth twice a day, morning and night, is really important. And the reason being is that bacteria that normally live in your mouth, you have a lot of bacteria in your mouth normally. Some of it's good bacteria, and some of it's not so good bacteria. And when the not so good bacteria is allowed to grow out of control in this lovely moist environment, you can then get other serious health challenges like cardiovascular disease and even diabetes. Both have been linked to bacteria out of control in the mouth. So, when your dentist or me ask you to please floss once a day and please brush twice a day, it's not just to keep your teeth white. It's actually to back down the bad bacteria that is naturally growing in the moist environment of your mouth. When that bacteria gets out of control, it can cause your immune system to be on high alert, but not necessarily in a healthy way. It can cause an inflammatory response. So another thing that happens when that bacteria gets out of control in your mouth, the bad guys, it causes periodontal disease. So your gums can start to bleed. You can start to get recession and the root of your teeth can start to show. And this is often these are signs of the bacteria getting out of control in your mouth. And this is a sign of an inflammatory issue in your body, which then tells me your immune system is probably struggling. It's been pulled away from killing other viruses and bacteria to focus on your mouth, where it really shouldn't have to work so hard. So a couple of tips. Use your saliva. I'll tell you why. So there's something called biofilms, and plaque is a perfect example of a biofilm. So biofilms are everywhere. They're also in our mouth. And biofilms are these brilliant little colonies, protected little colonies of bacteria. So a biofilm is like a little tent that keeps bacteria and viruses and certain fungi and sometimes even parasites hidden and safe, so that if you take an antibiotic or an antiparasitic or an herb, sometimes it won't get through this protective tent called a biofilm to actually get to the bug inside. This is one reason why diseases like Lyme can be so challenging. Not only are there biofilms around Lyme and co-infections of Lyme, but there are also, well, I'll talk about that later. Let's just stick with biofilms for now. So you have biofilms in your mouth, and one example is plaque. And so a way to disrupt the biofilms that could be causing bacterial overload and inflammation and immune challenges in your mouth is to floss, brush, and also gargle and swish. Back to saliva. Saliva is another way. So accumulating some saliva in your mouth once or twice a day and swishing it around your teeth. Some people might be saying, oh my God, that's so gross. But actually, Mother Nature gave you everything you need to stay healthy. And so doing this can help flush and swish away some of the bad guys. You swallow them down, and the acid in your stomach gets rid of them. So this can be super effective. Brushing, flossing, and gargling. Let's go to gargling, because not many people are talking about that, especially in terms of your immune system and the COVID virus. So if you're exposed to the COVID virus, it's going to come in likely through your mucosal membranes, your nose, your mouth. And one of the easiest ways, if you have an exposure, or you think you have an exposure, is to swish and gargle, which will either kill, depending on what you're swishing and gargling with, kill the virus in your mouth, or shove it down your throat into your stomach, and then the stomach acid will kill the virus. And so things to gargle with. I have a favorite doTERRA On Guard mouthwash that I like to gargle with. You can gargle with warm salt water. You can also gargle with a solution of apple cider vinegar and water. I use about 1 teaspoon of apple cider vinegar to about 2 to 4 ounces of water. It's fairly strong. You could go as strong as 2 teaspoons, and gargling with that and doing a quick swish. Now, you wouldn't want to do that too much around your teeth, the apple cider vinegar, because of the acid, but doing some gargles back in your throat and then spitting it out can really help kill stuff in your throat or help things go down so that your stomach acid can kill it. So the gargling with various things can help. If you're brave, you could take a little oil of oregano. Whoa, is that strong? But gargling when you have a sore throat, or if you think you've had an exposure to COVID, gargling with 1 drop of Carvacol oil, or otherwise known as oil of oregano or oregano oil, can really, really kill bacteria and viruses that might be lingering in your mucosal membranes. There are some other things for oral health that you can be doing. Neem oil is extraordinary. It's very, very bitter. But you can make a mixture of powdered neem with neem oil and make like a little pack with it and put it on your gums. And if you have old infections in your gums, the neem will get to it. Some people will even sleep with this on. Now again, it's very bitter, but if you're courageous and you really want to tackle your oral health, this is one thing that you can do at home. There's also special dental mud packs that can be used. I know Premier Research Labs has a Medi dental pack that I've used myself, and with many patients that's fantastic. And that can be mixed with apple cider vinegar. I also have mixed it with neem oil, and you can pack it around your gums, especially if you have issues with your gums, or if you had say your wisdom teeth taken out, if you are aware you might have a gum pocket somewhere. This can be excellent for drawing stuff out. You could leave it in your mouth for up to 30 minutes and then rinse it out. Yeah, it's clay, it's mud, but it is extraordinary for pulling stuff out. So consider that for future oral health. Another thing I'd like to talk about that's pretty controversial are root canals. There are some amazing books out there. You likely have a little more free time on your hand. It's a great time to read some books. So I definitely recommend my 2 books and books on root canals. There's a book called The Root Canal Cover-Up that was written by an oral surgeon, and it's phenomenal. And there's a bunch out there that you can check into. And basically, if you recall the dental chart I shared with you at the beginning of this live video, that's connected to all the organs, all the glands, all the systems in your body. This dental chart is super important for what I'm going to share with you. If you have had a root canal, please look at that chart, because it's very likely that you will have issues with that tooth and that part of your body. So it's very rarely that I find anyone who has a healthy, safe root canal. The reason being is when a root canal is performed, it's because that tooth is dead. And there is basically dead energy that's connecting to that other body part, gland, vertebrae, system, organ, etc. Not good. Because of the connection between the teeth and your entire body, having a dead tooth in your mouth is no bueno. Not just is the energy, but there is mountains of evidence of the amount of bacteria that can cause severe illness that gets locked into that root canal. What science is showing us is that even if that root canal is cleaned properly, which many of them are not, that there's still tiny little microorganisms that get in there and can cause a very large infection to stay hidden and festering in that tooth, and it slightly leaks out into your system. And your immune system has to deal with this, and it can get on overload very easily. And then your immune system gets out of whack, it gets out of balance, and it's struggling to fight this, but it can't quite get to it because it's in this mostly enclosed place with just this little bit of seepage. It can cause a lot of thyroid issues for people. It can cause brain issues for people. It can cause sinus and eye and ear issues for people. It can cause chronic throat issues and infections and tonsillitis and swollen glands and lymph nodes, all sorts of things. It can also affect the breast tissue and the lung tissue. So getting your teeth dealt with is so important, and addressing the root canals. So here's a tip around that. If you've got a root canal and you're concerned, please find a biological dentist. A biological dentist went to regular dental school. They're brilliant. And they understand the intimate connection, the relationship, we hope, between all of your teeth and the rest of your body. They're also often skilled with therapies like ozone. And ozone can be an amazing way to deal with infection in your gums or in root canals. We hope, or you can also ask them if they're skilled and knowledgeable with Zanum remedies. That's S-A-N-U-M. These are German homeopathic remedies that are phenomenal for dealing with dental issues, latent infections, gum pockets, bacteria and viruses, overloads, all sorts of things in the mouth, but also the whole body. But they're skilled with using it in the mouth. So ask them about ozone. Ask them about Zanum therapies. Ask them about alternatives to dealing with the root canals. One is get the tooth pulled. I'm not a dentist. I don't understand your unique individual dental health. So please find a biological dentist. But one suggestion that my biological dentist colleagues have shared with me is to get the tooth pulled and then consider a zirconium implant. That's different than some of the other metals being used. Some of the metals, like titanium, that are being used for implants are not biocompatible with someone. And they can really have a rough time after that, because now it's almost as if that tooth is like an antenna to a lot of signals in our world. We've got 5G and a whole lot of electromagnetic fields that are really taxing our systems. And sometimes people that get these titanium implants or other metal implants can have issues, but zirconium seems to be safer and more compatible with the human body. You can also have the tooth removed and get bridges. And this can be another very, very safe alternative, so you don't have to have such an invasive procedure. A biological dentist will also be looking at your bone structure, which is very important, and if your bone structure can withstand an implant or not. So they'll better be able to empower you with more information and individualize things for you. The other controversial topic I'd like to bring up, because I've studied with some incredible mentors in the field of functional medicine, biological medicine, and biological dentistry. Physicians like Dr. Thomas Rau, who used to run the Paracelsus Clinic, Dr. Dietrich Klinghardt. Many of these doctors have trained and worked with biological dentists. And what I've learned from them is that mercury can be incredibly toxic. I also want to give a shout out to Vanessa Morgan, a dear friend and colleague of mine, who helped identify that I had pretty high levels of mercury in my system, about 22 years ago. And before it was really a fad to get your metal out, to get your mercury out. I had been really sick with many, many symptoms of fibromyalgia, and heavy metal toxicity was one of the challenges. It was one of the blocks to healing that I wasn't aware of yet. And after I got my metal out and did a couple of years of different layers of detoxification and different kinds of chelation, things really changed in my system. I noticed a difference immediately. So getting mercury out of your mouth is not supported by the American Dental Association. However, it is very, very important. In my third book that addresses blocks to healing, that'll be coming out next year, I have a whole chapter on the history of the Dental Association and how in the beginning, that is where the pioneers were saying that mercury is toxic and it was killing people and animals. It's super toxic. And then there was a political shift in the Dental Association, and all of a sudden it was a cheap way to do a filling. And so it was promoted. Now realize in other countries it's illegal to put mercury fillings, amalgam fillings, in people's mouths. And in other countries, it's illegal to put it in the mouth of a pregnant woman because it is proven to pass through the placenta barrier. And those babies where pregnant mothers were given fillings, we have tested those babies and they have higher than any acceptable level of mercury at birth. And this is all documented. I'm not making this up. You might have to dig a little bit because the American Dental Association does not want you to hear about this. And my own experience getting my amalgams out, I learned about how to do a safe removal. And having mercury in your mouth is a block to healing and greatly impacts your immune system, which could set you up to get more infections and be more vulnerable to viruses and bacteria that are in our world right now. And so you may not be able to go get your amalgams out, but you can strengthen your immune system and address the issue little by little as soon as this pandemic resolves. So you can put that on your intentions list for this year. So here are a couple of my top tips to removing amalgams in a safe way. Please ask your dentist to put you on a nasal cannula of oxygen. Please ask your dentist not to use a dental dam. It can actually get things lodged down your throat. Instead, cover the tooth, surround the tooth with a ton of gauze so that as they're taking the filling out, it sprays onto the gauze and not down your throat. There are now lasers that are taking fillings out, that you can remove fillings and decay. Talk to your doctor about this, because vapors are most likely going to get released no matter how you get this filling out. We want to protect your brain as much as possible. Currently, every time you chew, you're releasing mercury vapors into your brain. It's just how it is. It's just how mercury is. So don't freak out. It's okay. I'm going to believe and trust that your body knows how to deal with this, because you are going to be an empowered consumer and you're going to follow up with a biological dentist, do your homework, and if you need more help or empowerment or support, please reach out to me and send me a direct message. And so after you get your amalgams out, you know what? If you have 8, don't get them all out at one time. Do a couple of quadrants at a time. Talk to your biological dentist, or feel free to reach out to me and we'll do a dental consult and I'll walk you through it. Then there are a bunch of very important remedies to support you detoxifying. So if you're on the path to getting them out, please reach out to me so that we can individualize a program for your biochemistry, for the amount of amalgam you have, and for how your organs of elimination are working. Do not, please, no matter what you do, please do not throw yourself into a mercury detox, especially if you still have amalgams in your mouth and you have not strengthened all of your organs of elimination. That's your lymphatic system, your kidneys, your colon, your liver. These are super duper important, and a lot of people go through all these detoxes and they're not really addressing the organs of elimination properly. So then they don't really detox well. They don't really get all the mercury out, and then it can cause other problems and get lodged in other places in your body. So that's my 2 cents on mercury. Thank you for receiving that. I understand it can be controversial, and I have extended family members who are dentists, and I have had many conversations with them, and I even bought them the root canal cover-up books because I wanted them to be informed. And if you're a dentist and you're listening to this, you have higher mercury in your body and brain than almost anyone else or any other profession. And so if you're interested in learning how to strengthen your organs of elimination and get rid of that, please reach out to me. I have some really good biological dentist friends who may be listening to this now, and I am in so much gratitude for the work that you are doing. Dr. Margolis in Phoenix, Arizona, we had worked together for many, many years. Thank you so much for the work you're doing. There were dentists, multiple dentists I worked with in Tucson, Arizona, even oral surgeons. Thank you, thank you, thank you for all the incredible work that you are doing with people. I'm just so grateful. Thank you, Dr. Rao, for everything you've taught me about biological dentistry, and Dr. Klinghardt, thank you so much. I also want to add that there was a time in my acupuncture career where I was doing dental anesthesia with acupuncture for mercury removals, as well as other dental procedures, including extractions. And so anesthesia, acupuncture anesthesia, was incredibly effective for an extraction that I worked with an older woman who is 70, who was very, very, very allergic to anesthetics. And so we used only acupuncture to have her tooth removed, and the oral surgeon was floored. This woman didn't flinch. She felt no pain. She felt some pressure, and that was it. It was incredible. I was sad that I hadn't videotaped it because it was so cool. So because we're talking about oral health, I wanted to give you a little inspirational story. So remembering that your mouth is connected to every part of your body. And the health of your mouth, your your teeth, your gums, your throat, is very, very important for a strong and balanced immune system. So please take good care of your mouth and your oral hygiene. And if you're just joining us, please go back and listen to the full feed, this full live video. I have a ton of information I've offered. And so grateful that you've joined me today. Thanks for listening. Please type your questions and comments below. And I'll see you tomorrow for my next Facebook Live. If you want to find me and my blogs and my newsletters and my recipes, and if you want to consult with me, go to GutHappyKeto.com. That's GutHappyKeto.com. And I'll see you tomorrow. Many blessings and be well. Thanks for joining. Bye.